You mentioned schizophrenia earlier in our conversation, and then you mentioned the potential onset of Alzheimer's given lack of sleep. Is sleep a fundamental predictor of mental illness or a contributing factor?
Yeah. So I got into studying mental illness because I had a very irritating conversation with a psychiatrist in an elevator. And he looked at me and he said, "Oh yeah, you work on sleep." And I said, "Well, sort of. I work on circadian rhythms, but yeah, there we go." And he said, "Oh yeah, well, my patients don't sleep." He was working on schizophrenia because they don't have a job. So they go to bed late, get up late, miss my clinic and don't have friends. And I thought it was just daft. So then got together with some other psychiatrists and Katharina Wolff, a close colleague, and we looked at the sleep-wake patterns of individuals with a diagnosis of schizophrenia. And as I mentioned, they were completely smashed. And then I thought, well, hang on, why is this? And we then built a very simplistic model about thinking of the relationship between sleep-wake disruption and mental illness. And what is clear is that the sleep systems draw from all of the brain neurotransmitters. In that flip-flop from consciousness to sleep,
right,
every brain neurotransmitter is involved at some level.
Wow.
So we thought, hang on, if there's a change in a neurotransmitter that predisposes you to a mental health issue, dopamine, serotonin, or whatever, it's going to have an impact upon sleep at some level. So we then thought, okay, but it's going to be more than that. So there could well be this overlap. But of course, the poor sleep, because it has such a distorting effect upon physiology and behavior, not least one's negative bias, for example, of the world, then it's going to exacerbate the mental health status. And of course, the mental health status could feed back and make the sleep worse. And there may be a contribution of the drugs. So these were predictable points. So we looked for genes that have been associated with mental illness and looked to see whether they had a role in the circadian and sleep systems. And many, many do, which is really interesting.
Oh, okay.
Yeah. And what's so fascinating is some of the genes that have been linked to sleep and circadian rhythms have been linked to mental illness. So there is that mechanistic overlap. And one experimental approach was to take, there's a gene called SNAP25, which has been linked to human schizophrenia. So what happens when you mutate that gene in a mouse? Well, you get abnormal behaviors. You can't say you've got a schizophrenic mouse, but you've got some abnormal cognitive and behaviors. But in parallel with that, you have smashed sleep-wake cycles. So there was empirical evidence that one gene mutated was not only affecting behavior, but was also affecting the clock. So support for that mechanistic overlap concept. What about it then? If we can consolidate sleep even partially in individuals, will we reduce levels of psychiatric illness? So Dan Freeman is a psychiatrist here in Oxford, and he led the trial whereby individuals who were showing insomnia and were showing paranoia and hallucinatory experiences, if after partial sleep deprivation, would those conditions improve? And they did.
Wow.
And that, I think, is so exciting because we can think now of the circadian sleep systems as being a new therapeutic target in mental illness. So that's the way the things have gone forward. So it really is extraordinary. A casual conversation in an elevator, which irritated me, has now led to a different way of thinking about mental illness. And going back to your original point, yes, the poor health is endemic in mental illness, as you probably may know from your studies. So with people with severe mental illness, the life expectancy is reduced by, on average, 25 years, which is huge. And what do they have? Well, they have coronary heart disease, they have metabolic abnormalities, they have obesity. Now, not all of it will be due to the sleep-wake disruption, but the sleep-wake disruption will certainly contribute to those poor health outcomes.